Hello?
Hi, my name is Carson, and I am a contact tracer working with Rainbow County Public Health. I have sensitive medical information for James Smith. Is he available to talk?
This is James. What are you calling about?
Hello, James. Because of the sensitive nature of the information and in order to protect your privacy, can you confirm your birth date for me so I know I have the correct person?
Yeah, my birthday is January 1st, 2001. Is this about my COVID test?
Thanks for verifying your birthday, James. Yes, it looks like your COVID 19 test was positive for the virus. I'd like to talk with you about how you're feeling as well as ask you about any medical problems you have. Would that be all right with you?
Yeah, I can do that.
Great. Well, let me go ahead and ask you a few yes or no questions to check your symptoms. Do you feel feverish?
No, and I took my temperature today. It was 98.7.
Okay, that's great. Did you use a thermometer that you point at your forehead or one you stick under your tongue?
I used the one you swipe on your forehead. It said 98.7 and was easy.
Yeah, we call those temporal thermometers, and they are really convenient, but they only tell us if your skin is warm. The thermometers you stick under your tongue are better for checking what your temperature is like in your body. How about a sore throat?
No.
Any muscle aches or joint pains?
No, I'm not having those.
Have you been feeling really tired?
No, I don't feel tired.
Headache, chills, or pain in your belly?
None of those.
How about loss of sense of taste or smell?
Nope, I can taste and smell everything.
That's good. Okay, this might be a very personal question, but have you had any diarrhea or constipation?
No, no, none of that.
Okay, so I'd like to ask, are you having any symptoms that I didn't mention?
No, I feel fine.
Okay, thanks. Now, since you're not having any symptoms, I would like to develop your isolation calendar around your test date. When did you get a COVID test?
And then I got swabbed 2 days ago. My friend who I was with told me he was tested for COVID because of his job 2 days before that. He didn't get the results until then. He called me right after.
Okay, so today is the 23rd. Since you're not having any symptoms, that means we will start what we call your infectious period on the day you got your test. If the test was positive, that means you could have potentially been spreading virus for as much as 2 days before the day you were swabbed. It also means you can spread the virus for up to 10 days after you got tested. Because of this, I'll need to know who you've been around since January 19th. This is so we can check on them and make sure they're okay too.
You're not going to tell anyone I have COVID, will you?
No. The law says that I can't tell anyone else about your positive COVID test unless I have your written permission. All I'm going to tell them when I call is that they were possibly exposed to someone with COVID 19, ask them if they are having any symptoms, and then tell them about quarantine. Have you had any contact with anyone over the last 5 days?
And just my roommate, he lives here with me, and we don't really go out anywhere. I knew I shouldn't have hung out with my friend a few days ago.
Okay, I'll need to have a conversation with your roommate separately, letting him know he could have been exposed and that he will have to quarantine. I'll get his name and number from you at the end of this call, okay?
As long as you don't tell him it was me, fine.
Of course. So, for this next part of the interview, I'd like to talk about your medical problems and any medications you may be taking. What have you been diagnosed with?
I had asthma as a kid, but not anymore.
When's the last time you had any problems with asthma?
When I was like 12, I only used an inhaler a few times a year, but then I grew out of it.
Okay, so no other medical problems?
No,
What medications do you take?
Tylenol when I have a headache, but that's really it.
Okay, thank you. Now I'd like to tell you about what isolation is. Are you ready?
Um, sure.
Okay, so since you don't currently have any symptoms and you were tested on the 21st, your isolation period will start on that day. You will need to isolate for 10 24-hour periods from that date. If you are capable of isolating outside of the home and away from your roommate, that would be ideal. If not, please make sure to stay in your room with the door closed. Try to find a room with its own bathroom so that you are not sharing bathroom space with anyone else. If you can't do that, please wear a mask when leaving your room and wash your hands frequently and sanitize all surfaces when you are done. Do not leave your home for any reason except a medical emergency, such as extreme shortness of breath, if your lips, fingers, or toes turn blue, or if you have chest pain. Do you have enough food in the home to last for at least the next 10 days?
Oh, wow. No, I don't think so. What about work? What do I tell them?
If you provide me with your email address, I can have the county health commissioner provide you with a letter to give to your boss explaining that you will be required to isolate for the next 10 days before you can return to work. This will help you keep your job. As for food, is there someone that can deliver some food to you? I want to stress the importance of not going out.
Um, I guess my mom could bring me and my roommate some food. Does he need to isolate too?
No. If he is not having any symptoms, he will need to quarantine for 14 days, starting on the last day he was exposed to you. If he is exposed to you any time during his quarantine period, he will need to restart his 14-day quarantine.
Well, I'm not having any symptoms, so can I really give it to anyone? I should be fine, right?
Actually, just because you don't have symptoms doesn't mean you can't spread the virus to other people around you. I can't stress enough the importance of not exposing anyone for the next 10 days. Now, if you develop any symptoms within the next 10 days, your isolation period will need to restart on that day. It's unlikely, but it can happen. When we call to check on you, let us know you'll need a new letter from the health commissioner so you have an updated one for work. Do you have any questions?
No, I don't think so.
Okay. I'll take your email address from you now as well as your roommate's name and contact information.
What did the contact tracer do well this time? The contact tracer refrained from using medical jargon, and this resulted in a very different interview with better and clearer answers from the case. Speaking in easy to understand terms allows contact tracers to be more effective when educating the community.